Hey, we have with us. Go ahead. I was just introducing you.
Edith Declan, a nursing professor and a clinical research investigator. She currently serves as a member of the advisory committee for the nursing program at the Houston Community College and a clinical advisor for a clinical informatics company named Safi. She has been the board chair for the nursing department at St. Mary's Community Hospital in Imo State, Nigeria, after losing her father to the complications of type 2 diabetes and her only sister to the complications of gestational diabetes. She decided to become an advocate for preventive health and education. She has spoken at several conferences and have served in various committees on preventive health. Since she became a nurse in 2013, her goal is to continue to teach preventive health so that families will not have to go through what she went through. Now, with a big round of applause and hearts full of expectation, let's joyfully welcome our speaker to the Winning Women Conference 2024, Edith Declan.
Oh my goodness. Was that me or was it somebody else? Where did y'all get that introduction from? Is somebody hacking into my computer? Yeah, because I don't think I wrote that much. All right, ladies and gentlemen, good evening. It's such a pleasure to be here. Please give yourselves a round of applause. All right, I want to say a big thank you to my sister. I call her Mimi, but she goes by Ederi, but I call her Mimi. And funny enough, let me tell you guys, when they talked about purpose, I hope my glasses are not too bright. Thank you, appreciate that. So I met Mimi through a friend, just casually, I'm telling you, but Mimi and I have been closer than myself and the person I met her through. So that is what happens when you're purposeful about your relationships, okay? So I'm not gonna take too much of our time. Thank you, Sister Sarah. Thank you, Mimi, for this opportunity. This is what I call my purpose. This is what I believe that God has sent me to do on earth. And I am doing it so excitedly. Thank you all for coming. All right, I want to say a big thank you to my sisters, my friends, Barbara, Queen, Diego, Oge. They are my biggest support system. Wherever you see me, you see them. We do everything together, okay? So I'm going to go quickly into what we have for today. Are we having a projection? Awesome, thank you. So I'm going to talk about cervical cancer. Cervical cancer. How many of us here are in the health field? Nurses? Okay, I see one sister here. I see one over there. I know my two sisters, nurse practitioners, psych, family. Okay. So how many of us own healthcare facilities? None of us. How many of us have actually taken care of cancer patients? You have. Okay. So 5 years ago, I was a cancer nurse. I worked with Baylor. Myself and my sister Ogechi, we were oncology nurses at Baylor. And my experience there was disheartening. You know, I love this small crowd because it's going to help me get really personal with a lot of experiences, okay? I took care of cancer patients, and what I saw left me heartbroken every day. On my first day at the job, when I got off orientation, my first patient died on me. It was a very terrible thing to behold. Beautiful young lady. She came in. She was excited. She was an air hostess. So you know how the air hostess look, right? Beautiful woman, tall. She was about my height or even taller. And then she came in. The first question she asked me was, "Am I gonna get better?" And when she asked me that question, I had no answer for her. I couldn't even tell her anything about how the entire process was going to go. So she came in, we did the first round of chemotherapy, and then she started having some side effects. And every time I came on the shift, I would hold her hands and I would, rub her hair and pray with her and reassure her that everything was going to be fine. But somehow when I came back to work, 2 days later, I heard she was taken to the ICU, and from there she passed on. So I had to go to the morgue to see her. Unfortunately, I couldn't identify her because it was a morgue about half the size of this room, and they had racks like the freezer racks, and it was people packed in those racks. There were babies on the left side, and the adults were on the right side. Children from Texas Children's Hospital, cancer patients were all packed in little bags like pillowcase bags. So I'm not saying this to scare any one of us. I am not saying this to get any one of us afraid or traumatized or anything of that sort. I am trying to say this because I believe in prevention. We're going to look at a few facts about cancer. Sister Sarah, I'm not sure what kind of cancer you had, but I had a very close encounter with cervical cancer 2 years ago. And when Ediri told me I thought she was going to ask me to just talk about health and exercise and looking good, right? Because that's what I like to talk about. And then she said, Edith, you're going to talk about cervical cancer. I wasn't sure what I was going to say because cervical cancer is something I dreaded. 2 years ago, I had a very close person to me who had cervical cancer. This lady, beautiful young lady, some of you here might know her. She would work out. She was gorgeous, drop dead gorgeous. And she was exercising. She ran marathons, and we thought everything was great until one of the days she went to the hospital. Her hemoglobin was about 6 point something. I wasn't talking with her, but I heard from a third party. And when they took her to the hospital, they gave her blood transfusion. She went home. She was so weak. By the time they realized that she had stage 4 cervical cancer, with everything was tried, medication and all that, guess what? A month later, this young woman died. So that is not going to be our portion by the grace of God after this meeting. The goal of this program today, I believe, is to enrich us spiritually and health-wise. So what are some key facts about cervical cancer? Can we go to the third slide, please? Oh, I don't see him there. You need to hire me next time. All right. So we're going to talk about cervical cancer. There are some key facts that I want us to, the third slide, please. There are some key facts about cervical cancer. Cervical cancer is the 4th most common cancer in women globally. I know some of us are wondering where the cervical cancer, where the cervix is. It is, I know we have kids here, so I'm going to try to be as polished or whatever, so, But anyway, the cervix is at the tail end of the vagina of a woman. So when you go for your pap smear, the doctor puts in a speculum. He is actually looking for the cervical, it's called the os. And he is actually looking at that little hole there that leads into the uterus. And as you can see right here, this is the vaginal wall right here. And then the cervix is right at the end of it. Now, this is what a cancerous cervix looks like. This is an advanced cancer of the cervix. Globally, there are about 660,000 new cases. So if you don't know anybody yet who has cervical cancer, you are very lucky. And there are about 350,000 deaths. There were about 350,000 deaths in 2022. So you see that this is not something that anybody should not be aware of, especially if you are a woman with a cervix. The incidents are highest in middle and low income countries. And I know some of us are like, listen, I've made it already. I'm rich. I'm not middle income, right? But a lot of us are from middle income countries. We have family members, grandmothers. How many of you have gone to the doctor's office and they ask you about family history? And what do you tell them? What do you tell them? If they ask, you don't have, right? If they ask you what your grandmother died of, what would you say? Juju? Okay, yeah, because that's all we know about. People are sick and people are diabetic and people have tumors and cancerous cells, and we don't call them what it's supposed to be called. We call them juju or voodoo, or somebody's chasing after you, or somebody did it to my grandfather. The same person that did it to my grandfather did it to my father, and they're coming after me. So those of us from low and middle income countries are at the highest risk for this kind of a condition. Black women, and this is from a research perspective, black women have the lowest incidence. Now listen, we have the lowest incidence, but the highest mortality rate. And do you know why that is? poor health-seeking behavior. Black women are most likely to die from every disease out there because of poor health-seeking behaviors. A lot of us have resorted to prayers and drinking a gallon of olive oil and, eating all the herbs in the market rather than do the things that we're supposed to do. We have annual screenings, we have blood work, we have pap smears, we have breast exams. But a lot of us have resorted to things that are the least resistive things. We don't want to have to go see a doctor. Maybe it's too expensive, but it's not more expensive than sending money back to Nigeria. We want to do everything but what we're supposed to do. So, there is a strong link genetically between the HPV virus 35 and cervical carcinogenesis in women of African ancestry. So we have the genes for cervical cancer, the HPV35 gene. Cancer diagnoses are projected to increase in our society, in our community, with a projected 44% increase in Black Americans. And when I say Black Americans, I'm not talking about people from Louisiana. I'm talking about all of us. I'm talking about every person with a colored skin. This increase is from 1.86 million to 2.4 million in the next 20 years. And as I speak with you, we have exceeded that 2.4 million, and we're not in 2024 yet. Now, what are the causes of cervical cancer? Cervical cancer is caused by a virus called a human papilloma virus. Let's go to the causes, please. This is a very common sexually transmitted disease, and it can affect the skin, the genital areas, and the throat. So please don't judge anybody. You hear somebody has cervical cancer, don't go say, hey, now let's show you they do. No, that's not true, okay? If you find somebody with some kind of illness, don't be a judge, because despite the fact that there are research and there are other causes, there are maybe 1 out of 10 things that you don't even know about. So don't judge people when you hear about stuff that they're going through. Most infected people do not show symptoms in the first instance, okay? In most cases, the immune system clears out the HPV virus. The immune system is something that fights the infections, right? So sometimes it will clear off the virus if you have a very strong immune system, but if you have anything fighting your immune system, you're getting sick all the time, or somebody has HIV, they have a higher chance of that HPV virus becoming cancerous. Persistent HPV infection can cause cancer in 95% of the cases. Now, typically, it doesn't happen overnight. Somebody can have HPV virus today and don't have cancer for another 10 to 15 years. So it takes a while, and that's why we should never relax. We should always take our health seriously, always go to the doctor. When you go see your doctor for your annual exams, try to get him as much as he can to do a pap smear. All right, so how do we prevent cervical cancer? It can be prevented by receiving the HPV vaccine. People between the ages of 9 to 14, and I know a lot of us, I do research, I'm a clinical research investigator, so I see a lot of Black people are really hesitant about being in research trials. The thing is this, if we look back into the 18th centuries when there were no vaccines, people died from polio, people died from malaria, people died from the things that we're surviving today. So you cannot tell me that you don't want to have your child get vaccinated, because that is really uneducated and uninformed. Vaccines play a role in disease prevention in today's generation, and we cannot do without them. So if you have a child between the ages, and the reason we put this at 9 to 14, this is when kids begin to get sexually active. So this is the age. Don't wait until your child gets diagnosed with HPV before you actually start thinking about getting them vaccinated. The other thing is screening. When a woman turns 30, usually I would say 25, because you don't want to wait until, we have a lot of guidelines. I was speaking with someone with prostate cancer the other day, and his PSA was 0.5. Normally, they will ask you to go for screening, to go for cancer screening when it's past over 4. But this man had prostate cancer with a zero point 0.5 PSA. So my understanding is that sometimes they set these guidelines so that a lot of people are not rushing to go through the process of screening. But of course, one of the reasons you have to go for screening is if you have a family history. But those of us who don't know our family history, what do? Wait until we're 50? So if somebody asks you next time you want to go do a pap smear, do you have a family history of cervical cancer? Yes. My mother had cervical cancer. My grandmother had cervical cancer. My great-grandmother had cervical cancer. You see them running to do your pap smear. Okay? So don't let anybody tell you. I was at a hospital. I went to see my doctor because I was having this right upper quadrant pain. It happens after I eat. And the doctor was like, "What? Do you have a family history of gallstones?" I said, I laughed. I said, "The only stone I remember is the one we eat in rice." I said, the stone from a father rice. That's the only one that my family had. I don't know about gallstones. Yeah, so we have to be very proactive with our health. We have to be very, very proactive. Now, at any stage or age, early detection followed by prompt treatment is very crucial. There are other things you can do to avoid cervical cancer. We're talking prevention now. Avoiding multiple sexual partners, it's not godly, it's not Christian-like, it's not religious, it's not moral. If you're smoking, stop smoking because smoking destroys the cells. And of course, if you're going to have any kind of sexual interaction, please try as much as possible to cover something up. Now, early detection. I'm going to go next to early detection so we save some time, okay? Early detection can enable treatment of cervical cancer. See a healthcare provider if for any reason you start having abnormal bleeding within periods. Now, I know some of us are turning 40 and we're thinking, okay, it might be fibroids, I might be getting into early menopause, but the worst thing you ever want to do to yourself is sit at home and make assumptions. Do not ever make assumptions. The moment you start having any kind of foul discharge, I know some people think it's okay to have foul, smelly discharge. It is not. If you start noticing any kind of foul, smelly discharge, please go see a doctor. I don't care what they tell you. Tell them you need to get it checked out. If you notice any kind of bleeding between periods or periods that are so long they're not stopping, go see a doctor. If you feel like your periods are changing in consistency, it's becoming more clotted, it's becoming just anything that is outside your usual, please see a doctor. Now, if you have any kind of persistent pain in the back, but we're women, we have this high tolerance for pain. How many of you have really felt pain before? You felt pain. We women have a high tolerance for pain, and that is not a good thing because a lot of these diseases, first of all, will make you feel pain, but then if you have a high tolerance for pain or you just, you don't want to think about it, then you might actually be ignoring a symptom of something. So when you feel pain, please listen to your bodies. Leg pain is not old age. Back pain is not always old age. Pay attention to your bodies. If you start noticing any kind of weight loss or loss of appetite, I know we're all trying to lose weight and fit in those summer dresses that we never fit into. I have some from 10 years ago. I keep hoping that it's going to fit someday. So if you notice any kind of unplanned weight loss, and the word is unplanned, so you're not exercising, you're not dieting, and all of a sudden you're beginning to lose weight, you need to go see your doctor. Any kind of vaginal discomfort. Now, I heard Pastor Shola had said something about, women wanting sex and the rest of that from their husbands. It is very, very necessary because sometimes you don't even know you have a problem until you do something, right? Sometimes you don't know. How are you going to know that you have vaginal pain if nothing is going on there? Okay? So from time to time, even if you're not in the mood, just use it as a cervical cancer test. Okay? Just say, hey, let's do this today, okay? I'm ready. Put on your lingerie, take a shower, put some cologne on, and he'll be shocked. Okay? But if you at any point in time begin to lose interest in the things that you used to love to do, then you might need to see a doctor. All right, so let's go to the next page where we have the pictures of the different stages of cervical cancer. I'm going to talk real quick about that. So these are the 4 stages of cervical cancer. Actually, it starts from a stage 0. I don't have the 0 here because 0 means there's really nothing, right? Now, the stage 1, we can see that the little dot right here. When you hear that the cancer is at stage 1, it means that it's still in situ. It's called in situ. It means that the cancer is still at the spot where it started, okay? Now, at this stage, treatment is possible, maybe radiation, maybe surgery. They can do a surgery to kind of clear out this entire area. Now, the next stage, if this is not treated or if it's not treated properly, is the stage 2. As we see stage 2, the cancer has eaten up the area around the spot where it started. At this point, there's still a lot of treatment options, radiation, surgery, maybe chemotherapy. Now, if you don't treat it at this point, and this does not happen overnight, that is why early detection is very crucial. This will take somewhere from months to years, depending on how weak or strong your immune system is. Now, the next stage is the stage 3, and you can see it. It doesn't look good, right? At stage 3, the cancer has eaten up the entire area around that orifice. At this stage, people might begin to show symptoms, okay? That is when they might start having the discharge, the lack of sexual appetite, or they start feeling weak and losing appetite and the rest of that. Now, at this stage, sometimes both of them kind of go hand in hand because by the time it's a stage 3, I'm telling you, it's already a stage 4. So at stage 3, they can still do some kind of surgery, but it's not always efficient or productive. At stage 3, the next thing you're seeing is a stage 4, and when it gets to stage 4, I am telling you that it has metastasized to other parts of the body. When I say metastasis, I mean traveled. The cancer has left, you see that origin, the little spot where it first started here, it has gone past that spot and to other parts of the body, maybe the lungs, the kidney, the brain, the back, and at that point, sometimes there's no remedy. Only Jesus can save that person. So, what am I trying to say, ladies and gentlemen? Early detection. Early detection. I do not want to come back here next year. I don't know how often you do this, to hear that somebody, God forbid, had something. Because the power to make change is in us. God has given us everything that we need. We are not novices. We have a lot of access to the information that we need to prolong our lives and give ourselves the quality of life that we desire. All right, so I'm not trying to waste our time. I already talked about the different treatment options: chemotherapy, radiation, surgery. And when these abnormal cells are found, the HPV cells, don't get scared if you go and the doctor says, we see some abnormal cells. Sometimes they're normal, okay? What happens is like they do warts, the skin warts. Sometimes they use cryotherapy. They can cauterize or cut off the wart and then, kind of treat that little area so it does not progress to cancer. All right, so finally, the key to wellness. Can anybody tell me the key to wellness? Anybody knows anything about wellness? Anybody? Yes? Nutrition, okay. Anybody else? Exercise, okay, wonderful. So I kind of hear that everywhere I go. Nutrition and exercise, those are the lowest hanging fruits, right? When you go to a tree, what do? Pluck the fruits that are closest to your hands, right? So somebody says, what is the key to wellness? You say nutrition and exercise. How many of you actually do nutrition and exercise? Okay. Oh, well, she looks like it. All right. Yeah, she looks like it. Not. We got a lot going on here. All right, so yes, the key to wellness is nutrition and exercise, but I want to share with us 3 key things. 3 key things that are very, very crucial to preventing cancer and to ensuring wellness. The first is sleep. Sleep is the most important thing that we need to function as human beings, because what happens when we sleep, our body does a lot of processing. A lot of waste is removed and excreted, right? When we wake up, we feel fresh and alive. How many of you have actually gone days without sleeping and see what it does to your brain? Okay, so when you're not getting enough sleep, your body is not building enough immunity to fight infections. So it doesn't matter what's going on in your life. Sometimes take Dayquil and sleep. Okay? Sometimes that person that says, oh, don't sleep, how can you be sleeping when I'm here? Tell the person you'll be all right. I need to sleep. Because sleep is very important. If I want to be there for you, I have to make sure that I'm healthy enough to be there for you. It's not about how much I send to your bank account. It's about how well I feel to be able to make that money. The next thing is chronic stress. Listen, ladies, stress is part of living. You see, like normal day-to-day stress, you go to work, come back, you cook, or sometimes you're not in the mood, you go order food and stuff like that. Stress is normal. But you see, chronic stress, that is abnormal. Some of us have chosen to live in chronic stress. Some of us have chosen husbands that have stressed us and we look like stress walking. It is not funny. I talk to people a lot. My husband will ask me, why you always get into people's businesses? I say, because I want to know why people behave the way they do. Why do you choose to stay in a relationship that is killing you and depriving you of God's purpose for your life? Stressing you. When God has designed somebody for you, I'm being honest, I'm a living testimony. My friends are here. God has designed somebody that would take you from point A to where God wants you to be. Sometimes you're subjecting yourself to that marriage because you believe that that's where you're supposed to be. That is not where God wants you to be. And you need to see things from a lens of God's word to know that that is not where he wants you to be. Chronic stress. Stressing after your children, stressing over your siblings, stressing over your job. Listen, when you are gone, all those things will still exist. It doesn't matter how much you think you can't do without them. They can do without you. They can do without you. Chronic stress kills. It reduces your body's ability to fight infections. You continue to increase the production of cortisol. Cortisol is this stress hormone. Fight or flight. Your body is always in a fight or flight mode. That is not good for you in the long run, because what happens is your body continues to believe that it's in a stress or fight or flight situation, and it has no time to settle down. Your body has no time to settle. So when the slightest of infection comes, you catch it. The slightest of viruses come, you catch it. The next thing, you're depressed. The next thing, you're taking blood pressure medicine, 1, 2, 3, 4. Then the next thing is village people that are after you. Ladies, we got to do better. Hallelujah. The last thing that I want to talk about is finding your purpose. When I came in here earlier and Sister Sarah was talking about me being here, I told her, I said, this is my purpose. If there is anything else in the world that gives me joy, it is doing what I am doing right now. When Adiri met me, talked with me about this, she said, Sister Edith, can you do this for us? Well, no. I said, sure. If you invite me to a dinner, I don't care where it is, I am not coming because I don't have the time. I don't have the time. But this is what I consider my purpose. So you got to find your purpose. Find purpose. What is God's intention for your life? Are you living somebody else's life? Are you trying to be like somebody else? You're trying to look like somebody else, or trying to talk like somebody else, or trying to think like somebody else? That is going to be the biggest source of stress for your life. Find purpose. What is that thing? Is it knitting? I see people, they love to make nice knits. Is it making hair? You don't have to be a doctor. You don't have to. People say, Edith, why don't you go be a medical doctor? I said, that is not my purpose. I love to teach. I'm not going to spend 18 years or how many years in medical school and come out and be teaching. No. I want to teach preventive health. And this is what I find most purposeful. I find it most fulfilling, most rewarding. Find your purpose in everything that you do, in making friends, in getting married, in your job. When you're picking that job, when they're offering you a job, don't look at how much they're paying you. Ask yourself, can this job make me fulfill my purpose? Is this job in line with God's plan for my life? Is this relationship in line with God's plan for my life? Is this family, is it in line with God's plan for my life? Find your purpose. Put that load down. You've carried it for too long. You are human. You've carried it for too long. He said, cast all your cares upon me. If you carry that load for too long, cancer is real. Put it down. Put down that friendship. It's not serving you. Put down that relationship. It's not serving you. That is not where God wants you to be. Chronic stress, lack of purpose, lack of sleep can cause cancer. Thank you guys for listening, and I hope you have a wonderful evening.